I hope to have a really good discussion with Mr. Hammond, just to make him aware of what pharmacists can actually do. There's a lot of services that we can introduce into the pharmacy that we're not being utilised for. Things like minor ailments, emergency care. We can reduce waiting times in hospitals or outpatients department, because a lot of patients can come to us before they go to the hospital.
What is your perception of community pharmacy at the moment?
Well, I think there's a huge number of things that the pharmacists clearly can do. I'm lucky in Wimbledon constituency we have 3 or 4 really high quality pharmacists, and also the chairman of the local pharmacy board, who since I've been an MP has impressed on me several times the sort of services that you see Raj Patel doing here that could be done more widely in terms of weight loss, in terms of smoking, and in terms of cholesterol, and working much more closely with the local GPs, if they were allowed to do a little bit more, would be a great benefit to the local community.
And what have you learnt from your visit today?
Well, I think first of all I've learned, one, what a great local pharmacist this is, but more importantly I think some of the issues that still remain that if we could sort out would be a great benefit to patients, some of the things that Raj has been mentioning to me today is what has happened at the PCT in terms of the minor injuries budget. What the sort of good things he's doing with repeat prescriptioning ought to become a standard practice. And so I've learned a number of things today which I think I'm going to go back and have a word with the Chief Executive of the PCT about. And he's just mentioned, which I think is part of a national campaign, which is if there was some access for pharmacists to patient records, then that would be, again, great benefit in terms of making sure that things that the pharmacists can do at a local level are actually really well done and made sure they're sort of in tune with the patient's health. And I think that's something that the Department of Health has to look at a national level. It's very important that they understand what exactly a pharmacist can do working in collaboration with the rest of the health service. At the moment, I think a lot of people have not appreciated possibilities that primary care can be delivered via the pharmacist. It doesn't just have to be delivered via the PCT or going to a day hospital for various things. There are a huge number of things that the pharmacist quite properly and sensibly can do, and I think the Member of Parliaments need to be really aware of those possibilities, so that they can see the complete range of services that could be offered.
How do you think pharmacists should go about engaging with MPs and with the government?
I get asked that by huge numbers of people, and I think lots of MPs just prefer different ways. I prefer people to write to me, raise an issue with me, and then I try and investigate it. I'm always very keen to come and see things myself. So today I'm here, tomorrow I'm doing visits to all sorts of other things which in my constituency. So personally I think one of the best ways is actually getting people to come down and meet their local pharmacists and actually talk to them.
I think the visit was tremendous. It was a pleasure to have Mr. Hammond come to the pharmacy. I had a very lengthy conversation about all the services that we can look to introduce and get commissioned by the PCT. I'm just very proud to have actually him take the time out of his day to come and visit the pharmacy.
Do you think it achieved anything useful? Do you think he's going to go away and take some good things from it?
Yes, definitely. He's taken numerous notes, and hopefully he's going to write to the Department of Health, see if we can get access to clinical data, and he's also going to write to our Chief Exec of the PCT to see if we can get the PCT to commission some more services through pharmacy.